If you're taking blood pressure medication every day, this is something I want you to pay close attention to. Over the years, I've treated many older adults with high blood pressure, and I've noticed the same four mistakes come up again and again. They don't seem serious at first. In fact, most people don't realize they're making them. But over time, these small mistakes can increase the risk of blood pressure dropping too low, lead to heart-related complications, or even raise the risk of a stroke. The good news is that they're all preventable once you know what to look for. In this video, I'll walk you through each one, explain why it matters, and show you what I recommend my own patients do instead. And I encourage you to stay with me until the end, because the fourth mistake is one that surprises many people and is often overlooked, even by those who believe they're managing their blood pressure the right way. Let's start with the first mistake, and it's one I see all the time. Many people believe that as long as they take their blood pressure medication exactly as it was prescribed years ago, they're doing everything right. It sounds reasonable, but that's not always how it works. The truth is, your body changes as you get older. The way your body responds to medication changes too. Your liver and kidneys gradually become less efficient, and those organs play an important role in processing medication. That means a dose that worked well 5 or even 10 years ago may not have the same effect today. It could be just right, it could be too much, or it may no longer be enough. Without checking your blood pressure regularly, there's simply no way to know. At the same time, your blood pressure isn't the same every day. It can change because of how well you slept the night before. It can be affected by the weather, emotional stress, daily activities, or other normal changes that happen from one day to the next. Even when you continue taking the same medication, your blood pressure may respond differently over time. That's why relying only on an old prescription without paying attention to your current readings can become a problem. I often tell my patients to think of it this way. Taking blood pressure medication without knowing your blood pressure is like driving through heavy fog. You're moving forward, but you can't clearly see what's happening around you. You don't know if the medication is keeping your blood pressure in a healthy range, or if it's lowering it more than it should. Both situations deserve attention, and neither should be left to guesswork. This is why regular blood pressure monitoring is such an important part of treatment. It doesn't have to be complicated. Check your blood pressure on a regular basis, write the numbers down, and keep a simple record. When you go to your follow-up appointments, bring those readings with you. They give your doctor a much clearer picture of how your blood pressure is responding over time, not just on the day you're sitting in the office. That information makes it much easier to decide whether your current treatment is still the right one or if any adjustments are needed. Just as important, pay attention to how you feel. If you begin noticing dizziness, unusual fatigue, or cold hands and feet, don't assume it's simply part of getting older. Many people dismiss these symptoms because they think they're a normal part of aging, but they shouldn't be ignored. They may be signs that your blood pressure is lower than expected, or that your current treatment needs to be reviewed. Instead of guessing, check your blood pressure and discuss those changes with your doctor. Small changes in your daily routine, combined with regular monitoring, can help make sure your medication continues to work safely and effectively as your body changes over time. The second mistake is something I see surprisingly often. Many people decide to take an extra dose of their blood pressure medication simply because they don't feel well. They may wake up with a headache, feel unusually tired, or become a little dizzy during the day. Their first thought is often, "My blood pressure must be high." Without checking it, they take more medication, hoping it will solve the problem. While that may seem like a reasonable decision, it's not always the right one. The problem is that these symptoms don't automatically mean your blood pressure is elevated. A headache, fatigue, or dizziness can happen for many different reasons. You may simply be dehydrated. You may not have slept well the night before. Your blood sugar could be lower than usual. Sometimes it's a combination of several small factors, rather than a sudden rise in blood pressure. The symptoms can feel very similar, which is why relying only on how you feel can easily lead you in the wrong direction. I've had many patients tell me they were certain their blood pressure was high because they felt dizzy or had a headache, but when they actually checked it, the reading was completely different from what they expected. In some cases, their blood pressure was already in a healthy range. In others, it was actually lower than normal. If they had taken additional medication based only on their symptoms, they could have lowered it even further without realizing it. This is where people can unintentionally create a much bigger problem. If your blood pressure is already normal, or even slightly low, taking an extra dose of medication may cause it to drop to an unsafe level. Blood pressure that falls too low can leave you feeling even weaker, more lightheaded, or more unsteady than before. Instead of helping the situation, the medication may actually make those symptoms worse. That's why I always encourage my patients not to let symptoms alone make the decision for them. Your body can give you clues, but those clues are not always specific. The most reliable answer comes from measuring your blood pressure, not guessing what it might be. So if you suddenly feel tired, develop a headache, or become dizzy, don't rush to take another pill. Take a few minutes to sit down and rest. If you think you may be dehydrated, drink some water. Give your body a chance to settle. Then check your blood pressure before making any decision about your medication. That single reading provides much more useful information than symptoms alone. Just as important, try to keep your medication schedule consistent from day to day. Blood pressure medicines work best when they're taken as directed and at about the same time each day. Constantly changing your routine because of how you feel on a particular morning or afternoon can make it much harder to keep your blood pressure stable over time. Remember, your goal isn't simply to respond to every symptom you notice. Your goal is to manage your blood pressure safely and consistently. Before taking an extra dose, give yourself a moment to pause, check your blood pressure, and make decisions based on real information instead of assumptions. That simple habit can help you avoid unnecessary risks while allowing your treatment to work the way it's intended to. Now let's talk about the third mistake. This is another habit I see quite often, especially in people who regularly check their blood pressure at home. After seeing a few readings that are higher or lower than they expected, some people decide to adjust their medication on their own. They may take an extra pill because they think their blood pressure is too high. Others may skip a dose or cut the amount in half because the numbers look better than usual. It may seem like a simple way to keep blood pressure under control, but making those changes without medical guidance can create new problems. One thing many people don't realize is that blood pressure goals are not exactly the same for everyone. As we get older, our bodies respond differently than they did years ago. Blood pressure in an older adult does not necessarily need to be as low as it would be for a younger person. Trying to push it lower simply because a smaller number seems better is not always the safest approach. In fact, lowering blood pressure too much can sometimes do more harm than good. Your brain, your heart, and your kidneys all depend on a steady blood supply to function properly. If your blood pressure drops too low, those organs may not receive the blood flow they need. That doesn't always happen suddenly. Sometimes the first signs are easy to overlook. You may feel dizzy when you stand up. You may notice that you're less steady on your feet. Some people become more forgetful or simply don't feel as sharp as they usually do. Over time, blood pressure that stays too low may place unnecessary stress on important organs that rely on healthy circulation every day. This is why I encourage my patients not to react to a few isolated blood pressure readings. Blood pressure naturally changes throughout the day. It can also vary from one day to the next. A single higher reading doesn't automatically mean your medication needs to be increased. A single lower reading doesn't necessarily mean you should reduce your dose, either. Looking at only one or two numbers rarely tells the whole story. Instead, monitor your blood pressure over several days. Keep a simple record of your readings, and look for patterns rather than focusing on one result. When you bring those records to your doctor, it becomes much easier to see whether your blood pressure is consistently changing or whether those readings were simply normal day-to-day variations. That information allows treatment decisions to be based on a complete picture instead of a single moment. Most importantly, don't increase, decrease, or stop any blood pressure medication without discussing it with your doctor first. Even small adjustments can affect how well your treatment works, and those changes should always be made with a clear understanding of your overall health, not just one blood pressure reading. It's also important to keep your regular follow-up appointments. As your body changes with age, your treatment may need to be reviewed from time to time. Routine visits, along with periodic checks of your liver and kidney function, help make sure your current medication is still the right choice for your health. These simple steps allow your treatment to stay safe, effective, and appropriate for where you are today, not where you were several years ago. If you found these first 3 mistakes helpful, I'd appreciate it if you took a moment to like this video and subscribe to the channel. There's still one more mistake to cover, and it's one I see very often in older adults. Let's take a look at that next. Now let's look at the 4th mistake. This is one I see very often, especially in older adults who are being treated for several health conditions at the same time. It's common for someone to take medication for high blood pressure, along with other prescriptions, vitamins, or dietary supplements. Over time, the number of pills can quickly add up. The problem begins when new medications or supplements are added without talking to a doctor first. Many people assume that if a product is available over the counter or labeled as a natural supplement, it must be safe to take with everything else. Unfortunately, that's not always true. Combining multiple medications or supplements without proper guidance can lead to unexpected drug interactions. Some combinations may change how your blood pressure medicine works. Others may increase the chance of unwanted side effects. These problems are often difficult to recognize because they can develop gradually rather than all at once. This becomes even more important as we get older. With age, the liver and kidneys naturally become less efficient. These organs are responsible for processing and removing many medications from the body. When they don't work as efficiently as they once did, medications may stay in your system longer than expected. As a result, the risk of interactions and side effects can become higher, especially if you're taking several different products every day. One simple habit can make a big difference. Every time you go to a follow-up appointment, bring all of the medications and supplements you're currently taking. That includes prescription medicines, over-the-counter products, vitamins, and herbal supplements. Having everything in one place allows your doctor to review your complete medication list and identify any combinations that may need attention. It's also important to understand how each medication should be taken. Know which ones should be taken in the morning or evening, and follow the schedule your doctor has recommended. If you're thinking about adding a new supplement or another over-the-counter product, don't assume it's automatically safe. Take a few minutes to ask your doctor first. That simple conversation may help prevent unnecessary problems. Finally, if you're taking several medications over a long period of time, don't overlook the value of regular liver and kidney function tests. These routine checkups help your doctor make sure your body is still handling your medications appropriately and that your current treatment remains the right fit for your health. Regular monitoring, combined with good communication and careful medication management, is one of the best ways to keep your treatment both safe and effective over the long term. As we wrap up, I'd like to leave you with one important reminder. The goal isn't to take more medication. The goal is to take the right medication, at the right dose, and at the right time. Today we talked about 4 common mistakes: taking medication without regularly checking your blood pressure, making decisions based on symptoms alone, changing your dose without medical advice, and combining multiple medications or supplements without proper guidance. If you take just a few minutes to review how you're managing your medication each day, you may discover small habits that are worth improving. Those small changes can make a meaningful difference over time. Along with taking your medication as prescribed, continue to eat a healthy diet, stay physically active in ways that are appropriate for you, get enough sleep, and speak with your doctor if you notice any changes in your health or your blood pressure. Thank you for spending your time with me today. I hope you found this information helpful. Take good care of yourself, stay well, and I'll see you in the next video.